Inauguration of the Global Heart Watch, a global hospitals preventive initiative.
My beloved chairman, Dr. Ravindranath, my good friend and my senior colleague from Stanley Medical College and currently the President-elect of Association of Physicians of India, Dr. Muruganathan, and Mr. Nayanantarian, Vice President and Respondent of Times of India. Symposium and the inauguration of the Global Heart Watch, which we have scheduled for today, will be serving one important aspect for the prevention of heart attack. The Global Heart Watch is a concept where we are extending the idea of the global group's motto of caring for lives by inculcating a spirit to prevent heart attacks in the community. The Heart Watch is a program which we are planning not just for today. Today is the day which we inaugurated. It's going to spread out to the community on all days of the year, 365 days, and particularly on important occasions where we have days dedicated for various entities where
Thank you, ma'am.
A collective consciousness among people. Sometime back, we had launched another program to create better awareness about the 7 risk factors associated with cardiac troubles, and that was named as the Million Heart Beating Program, which was an all-India attempt, and nearly 3.5 lakh people have taken oath that they will either avoid fatty food, or they will control their blood sugar, or they will control cholesterol, and so on and so forth. These kind of cooperative efforts by both media and leading hospitals like Global Hospital would make a lot of difference. It is compounded as studies suggest that our genetic from India by 2016, and by the age of 65, a woman's risk is almost the same as a man's. Worldwide, nearly 1/3, which is about 8.6 million of all the deaths in women are from heart diseases. Now, how does media partner with hospitals like the renowned hospitals like Global Hospital to bring in certain change in people? Media in today's society has by far the strongest impact on the behavior of children, individuals, families, communities, and the societies at large. However, health messages through the media have not been shown to be consistently effective in reversing adverse lifestyle changes or promoting healthy lifestyles. The Times of India and Apollo Hospitals took upon themselves to reverse this trend. On 28th of April 2010, India woke up to a heart campaign that was the largest ever initiative in the country.
I request you, sir, to give the special address on the
of Global Hospital, Dr. Ravindranath. I am delighted to be here to inaugurate the golden hour in heart attack. Normally a layman says, we want to kill time, but it's the other way about. If you don't do properly, the time will kill you. That is the message. In fact, I am very happy our Times of India Vice President has collected a lot of data, very impressive data. But I want to reinstate one sentence. 80% of the cardiac deaths and stroke deaths are preventable. That is a very important point, 80%. another point I would say, because the media people are here, you must highlight this point particularly. This year World Heart theme is One World, One Home, One Heart, which means the prevention should start from the house, from the home, from the community, from the state, from the country, worldwide. The underlying point again, I would like to emphasize, for women, this year, the World Heart Foundation says, go red for women, go red for women. In fact, I will request Ravindranath to have a women's photograph in the hospital or wherever the Global Watch with the red sari, so that this is called Go Red Alert for Women. What is this women importance? Out of, he said, 19.1 million deaths globally every year because of heart attack and stroke, out of which 9.1 million deaths in women. It is more than cancers, HIV, tuberculosis suffered by women. This awareness is very less. Up to 1997, the women heart awareness, health awareness is only 37%. Only recent statistics says they have gone up to 50% aware. They are not fully aware. Only 50% women are aware of their heart problems. They are underdiagnosed, they are undertreated, awareness also less. So that is why the World Heart Foundation and cardiologists all over the world said, go red for women.
Nayanatharan, Times of India, and President-elect of Association of Physicians of India, my colleagues on the dais and off the dais, distinguished cardiologists and delegates and ladies and gentlemen. My previous speaker said is very, very important, that I think we need to educate our neighbors. That's one of the important programs we do in cardiac. And also, golden hour is something which is very important. When something happens like heart attack, I think we need to educate not only the community, and most important thing is the general practitioners, because that 1 hour, golden hour makes a lot of difference in terms of reducing morbidity and mortality. And as our previous speaker said, that 80% of the cardiac ailments are preventable. I think we should all do that by better lifestyle and eating habits, and of course avoiding pollution or green revolution, something like that, very important. We're seriously working on this campus, whole campus, making it a green facility, and that is our next initiative. And maybe we should spread this to the others and also neighborhood to reduce pollution, and all these things makes life better and probably meaningful to our next generation. The golden hour concept is very, very important. I think amongst the medical professionals, we must be well aware, and we need to spread this message, because many times, if the patient arrives in the first hour, they are almost cured by thrombolysis or proper diagnosis and thrombolysis. And again, diagnosis and immediate treatment is very important. That is something which is today, I understand you're all going to have a lot of lectures by eminent speakers. That is something we would like to educate or improve the knowledge of our general practitioner friends. That's how we can do better service to our patients. That is something which we are very, very focused on, and similar activities will happen in other specialties as well. And this is something which is a responsibility to our profession. Global Hospital will be always in the forefront.